2022. That's kind of odd to say, but we'll get used to it eventually, I suppose. So we're going to spend a little bit of time today talking about mental health in the workplace. Um, One of the side effects of the COVID pandemic has been a renewed conversation about the importance of mental health at home, at work, at school, and so on. And, you know, with the renewed focus, we're also looking at some practical things that we can do. So we're going to talk about this. If you have questions, drop them in the chat, or if it's really something that you have to expound on, you can ask to be unmuted, and we can have a little quick chat. But we're probably going to leave a little bit of time at the end anyway. So here we go. So first off, when we talk about mental health in the workplace, we want to define what we're talking about when we mean mental health. I've heard a number of people, say something like, "Oh, mental health, I don't have that." But yes, you do. I mean, everybody has mental health. That's your condition of psychological and emotional well-being. It's distinguished from, but similar to, your physical health. It's also affected by your physical health, and it affects your physical health. Your brain and your body are integrated. Sometimes you'll hear the term somatic health, and I'll use that a couple of times today. Somatic means of the body, which distinguishes it from mental health, which means of the brain. The two most common types of mental illness or mental health challenges are depression and anxiety. Anxiety being kind of an overheightened fear response. Anxiety can be general, just a kind of a constant general sense of dread or worry, or it can be specific. We probably all know people who are afraid of public speaking, for instance. Probably the number one type of anxiety or fear is the fear of speaking in front of others. But you can have fear of spiders or snakes or heights or enclosed spaces. All of those are very specific anxieties, but there's also something called generalized anxiety disorder, which just means your fear senses are kind of always in overload. They're always kind of running all the time. Those are the two most common. Other common diagnoses for mental illness that you may know about: substance use disorder, kind of its own category, but related to mental illness, in that there's a lot of brain chemistry going on in substance use disorder, alcohol use. Psychosis, less common, but one that is often portrayed in movies and on television. Post-traumatic stress disorder. I think we all have heard that term before. And if you just parse it out, post-traumatic means after a trauma, and stress disorder means that the stresses after the trauma continue to affect your life. PTSD is often associated with our military veterans who have, especially those who've seen combat, but it can also be our public safety folks, police, fire, EMTs, who have to deal with fairly horrific circumstances on an all too regular basis. And those traumas can lead to long-term stress disorders. And PTSD can also arise from experiencing episodic traumas, such as weather events, tornadoes, floods. You all saw the news item, right, about the miles and miles and miles of cars that were stuck on I-95 for like 27 hours. A significant number of those people are going to, for a while, associate driving on a highway or driving in bad weather with that experience, and it's going to cause them to change their behaviors or suffer anxiety, and that's a form of post-traumatic stress disorder. Some other diagnoses: eating disorder, bipolar disorder, gambling disorder. Gambling is a relatively new category of mental illness disorder, but we know that gambling works because it activates the reward centers in the brain, and it's for some people it is quite literally addictive, that people become addicted to the endorphins that are produced during the process of gambling. And it's roughly about the same, percentage as some other of these disorders, and we do treat it as such. Gambling also can be used as a self-medication or distractive activity for people who are suffering in other ways. If you feel like you're powerless and helpless, maybe going out and buying a lottery ticket and having that, that moment just before you hit the scratch off of maybe this is the one, you get that rush of hope or possibility or whatever. And unfortunately, the statistics on it indicates that you're probably not. But it's the rush of anticipation that people kind of get addicted to. Generally, when we're talking about mental health in the workplace, just more common mental health as opposed to clinically significant diagnoses, we're talking about feelings of being overwhelmed, feelings of being upset over a long period of time or over things that are not that specific. Being sad in response to a loss is a normal emotion, but if you're sad for a long time, even after that loss has kind of passed into the distance a little bit, that is an indicator that maybe there's something going on. Feeling out of control, and how many folks recently have had that feeling that they have no control in their lives anymore, that everything is out of control, that they're being told what to do, where to go, where not to go, and so on. Those feelings of being out of control over a prolonged period of time can definitely lead to mental health problems. Same with feeling isolated and lonely. And again, we kind of have to frame all of these emotions in the context of the pandemic, because the pandemic did increase isolation and loneliness for a lot of people. They were not able to visit relatives. They're not able to travel. In some cases, they're not able to work. And that feeling of isolation, the feeling of loneliness really kind of ramped up. And then, of course, any kind of sense of impending death or major loss. Again, if you're worried about that, if you're obsessed about that, and if you're watching the news or what do they call it, doom scrolling on the internet all day long, and all you hear about is hospitalization numbers and death numbers and tragedy and everything else, if that's your constant input, then you are going to probably be at risk of developing that that intrusive thought about death or intrusive thought about potential major loss. So all of these things are clearly in the context of the pandemic, they've clearly been ramped up to a significant degree. When we talk about mental illness, a diagnosable mental illness, really the clinician is going to look at when systems persist over a period of weeks to months and in more than one context. So, if you are only anxious while you are at work, but you're not anxious at home, you're not anxious in social settings, you're not anxious when you're shopping, that's going to pinpoint that maybe there's something in your work environment that you're anxious about, as opposed to a general mental health question. And, as I mentioned before, a sadness or a fear in the moment, if you have suffered a loss or you've been threatened with a car accident or a weather event or whatever it is, in the moment, the fear is a normal, expected response. But if that persists over weeks or over months, and it's impacting your ability to work, to maintain relationships, or just generally enjoy life, that's when we're going to be looking at a clinical diagnosis of mental illness. Okay. So as I said before, mental illness may occur with somatic illness. There's pretty good research that links things like generalized back pain with depression. And the spiral that happens there is that depression makes back pain feel worse, and back pain makes your depression worse. It's a self-stoking, reinforcing cycle. So one or both of those conditions needs to be treated if you're going to get out of the cycle. The same is true with injury, with illness, substance use. You know, people who've contracted COVID, since that's the topic that we're in right now, and who have what's called long COVID, the persistent symptoms of malaise, of loss of smell, loss of taste, maybe some lung or respiratory issues over a long period of time, are at significant risk of also developing depression because of the loss and the change to their lifestyle. And then I think we need to say specifically that these mental illnesses exist on a spectrum from mild to severe. When we start looking at numbers, that the numbers are going to be really high. That doesn't mean everybody is at the severe end of those spectrum, that spectrum. Somewhere in the mild to moderate is what most people are going to experience most of the time. Occasionally we get severe mental illnesses that really need intervention, hospitalization, and so on. But for the most part, it's mild to moderate that can be managed with self-care, can be managed with less intrusive forms of treatment. And then there's also kind of a spectrum between episodic and chronic. Certain mental health responses may be to a specific event, and after a period of time, those symptoms ease, those symptoms kind of alleviate. Those would be episodic. But for some people, for reasons of brain chemistry, for reasons of environment, for reasons of structural things in their brains, may have these illnesses for the rest of their lives. And for those, we consider those to be chronic or persistent. So somebody could have a mild episodic response to a situation, and they're going to either get better on their own or with some relatively easy self-care, they're going to improve, and it will be in their past. But on the other end of the spectra, we have the severe and persistent mental illness. Those are the folks that we have housing supports, we have hospitalization supports, and so on, that we really work on as a board. So just understand that those do occur on a spectrum. Like other health conditions, early detection and effective treatment will lessen the condition's severity and impact. The sooner people identify a developing mental health condition and then undertake treatment, the less likely that is to become severe and have long-term impacts on their lives. We do a training called Mental Health First Aid that is specifically designed to teach lay people, non-clinical people, how to identify the signs of a developing mental health crisis and take steps to intervene before it becomes a crisis. Because we know that early detection is effective. We also know, unfortunately, that the median length of time between the development of a mental health condition and that person seeking professional help can be as long as 10 years. And there's a lot of things that can go badly during those 10 years. So we do a lot of things, a lot of training and awareness campaigns and whatnot to help people identify early and seek help early, so that it doesn't become long-term and severe. So specific to COVID-19, there was a study conducted by Vita Health, and of the participants in the study, 88% of participants said they had experienced one or more depression symptoms during COVID-19. 88%. What that means is 12% of the people were lying, because I think we've all experienced at least one depression symptom during COVID-19 for at least a little bit of time. If we look at the list of symptoms for depression, sadness, anxiousness, feeling empty or directionless, feeling hopeless, irritability. Honest, how many of you have been irritable sometime over the last 24 months? Yeah, absolutely. Feelings of guilt, loss of interest in hobbies and activities that you used to enjoy, decreased energy and fatigue, feeling restless, having difficulty sleeping, appetite or weight changes. All of these things are pretty common. And if we're all honest in answering a question, have you experienced any of these symptoms during COVID-19? I think most of us are going to say yes. Where it gets to be concerning is if we're starting to get intrusive thoughts of death or suicide, or intrusive thoughts of violence toward others. In those cases, intervention really needs to happen pretty soon. So why are we talking about mental health in the workplace? Well, because according to statistics kept by the Centers for Disease Control, depression causes 200 million lost work days each year. This is in the United States alone. 200 million lost work days each year, costing somewhere between 17 to $44 billion to employers, depending on what you count as the loss. It is a significant impact on our economy, on businesses' profitability, and their ability to retain workers and be productive. Significant impact. More impact from depression than impact from heart disease, if you can imagine that. There is more lost time at work because of mental health concerns than there is because of what we would call somatic or physical health concerns. It really is the number one cause for lost productivity in the workplace. According to a study cited in Forbes, half of employees with depression are untreated. I would guess that number's actually higher than that. And more concerning still, and this is a 2021 study, this was just a year ago, almost half of the people surveyed believe that getting mental health help is a sign of weakness. That's a problem. That's the result of stigma. That's a result of misunderstanding what mental health and mental illness is. And it's a communications problem that I spend a lot of time thinking about and working on and trying to educate people. Still, in the United States, half of the people, more or less, will think that getting mental health help is a sign of weakness. I don't think we have any other correlates that are even close to that. If you broke your leg, would going to an orthopedist be a sign of weakness? No, it's not. It's how you get fixed and how you get back to normal. If you have the flu, everybody trots off to urgent care to get some sort of medication to deal with that flu. It's not a sign of weakness. It's a sign of strength and wanting to get better. For our employers, there are at least 4 major areas that depression and anxiety, to a slightly less extent, but mostly depression and anxiety, impact. The first is absenteeism. One of the things that people who have moderate to severe depression will say is that they literally could not get out of bed in the morning. You know, they wake up after a restless night's sleep and they just can't muster the will to get out of bed. It's not laziness. It's not that they don't want to, it's that they can't. And if people can't get out of bed in the morning, they're not going to go to work either. If they do manage to get to work, they have a lack of focus, they have lack of energy, and that significantly impacts productivity. You know, even if they're there, if they're filling their seat, if they're standing on the line, they may not have the focus and the energy to be as productive as they should be able to be. A third way that I think most of us tend to not consider enough is, what is the impact on the workplace climate? If you have a person in a key position who is really suffering from depression or suffering from anxiety, it's not just them. They're impacting everybody around them. If they're unable to be productive, their coworkers have to pick up the slack. If they are vocal about their feelings, then they are imparting negative thoughts to their coworkers, to their work groups. And it can actually bring down the productivity of the entire group, not just the individual. So we focus on the individual in terms of getting help, but it does impact the entire workplace climate. And then the fourth part is employee turnover. And we'll talk more about employee turnover, but it costs money to hire people, to train people, to, you know, really make them part of your team. And if you're in a constant churn of employees because their work environment and their home environment are feeding into depression and anxiety, then they are more likely to quit. They're more likely to quit on short notice, and really cause you much difficulty in terms of just onboarding and, you know, keeping a trained workforce up. So at least those four things we should all consider: absenteeism, productivity, workplace climate, and employee turnover. So this was interesting. I went out and did some searching on why workers quit. We're in right now, you've heard the term, the Great Resignation, right? People are quitting jobs at an unprecedented rate. The opposite side of that is that people are also creating self-employment opportunities, and they're hiring on at unprecedented rates. In one period, there were something like 4.5 million quits, but there were 6.7 million new hires. So, you know, yes, a lot of people are quitting, but they're also getting other jobs. They're not quitting and not re-entering the workforce. But this job posting service called Job List, some of you may use Job List, did a survey of their the people who use Job List and, you know, who are looking for new jobs, and they asked, why did you quit your last job? And the number one answer was seeking new careers. 1 in 5 people said they were seeking a new career, which is understandable. People, you know, like to continue to work through a process and find something they like and something that's rewarding and able to support them in the lifestyle that they aspire to. But interestingly enough, the number 2 reason on the list, only 1% below, so for statistical reasons, exactly the same as seeking new careers, was that they were unhappy with how their employer treated them during the pandemic. 1 in 5 people who quit their jobs on the Job List survey said the reason they quit is because they were not happy with how their employee treated them during the pandemic. That's very specific. And we can all, you know, think of specific examples of how that happens. Because of, some people were designated as essential employees and had to go to work when everybody else was told to stay home. We had people who were told to stay home who wanted to be in the office. We had people who, were told that they have to wear masks while they're working. We have people who are told they have to get vaccines and they don't want to get vaccines. So anytime there's discord between what the employee wants to do and what the employer is asking them to do, there's potential there. And how the employers broach those subjects counts as much as what they're asking the employees to do. So I thought that was a very interesting statistic. It was literally tied for first place with seeking new careers. So really what we want to do is get to the question, what can you do about it? What can you as an employer do to improve the mental health climate in your workplace? And this isn't my opinion. I did a lot of research on this and kind of aggregated some suggestions, but the number one thing was show compassion. Understand that people are struggling. Understand that many people don't like change. That sudden change, especially change imposed from the outside, is a significant stressor. So just be compassionate, be empathetic with people. I understand this is going to be a disruption in your life, but in order for us to succeed as a business, we really need you to do X, Y, and Z. And, get some buy-in. Don't just say you need to work double shifts or you need to work overtime, but say, I'm going to ask you to work overtime because it's really important for the business that we do that right now. And just the approach, just the words you use and the tone you use can make a huge, huge difference to prevent that thing about being unhappy with how their employer treated them. If you treat them nicely and ask them to do nasty things, they're more likely to do the nasty thing than if you just tell them to do the nasty thing and you're nasty about it. That seems pretty obvious, but we're all under stress and we don't always think about how we are coming across to other folks. The second thing you can do is acknowledge the stressors in the workplace. Don't deny them. Don't try to sugarcoat it. Understand that these are unusual times and there are unusual stressors in the workplace. Just acknowledge it. Just, again, be empathetic. Some of these are, COVID specific and some of them are not. There are physical stressors in the workplace, having to stand for extended periods, for instance, or working where there's a lot of noise, or working around dangerous equipment. Those are all stressors. And you want to acknowledge those stressors so that your employees will understand them as necessary conditions for the job that they then can pay attention to and try to minimize the stress. Based on the survey result we saw earlier, I think it's important that we educate employees that receiving help's not a sign of weakness, that receiving help for mental distress, for mental illness, is in fact a sign of strength. It's a sign of wanting to be better. And just encourage it. You can do that with posters, you can do that with employee newsletters or emails or paycheck stuffers or whatever it happens to be. And if any of you would like some input and guidance on some ways to do that in your specific workplaces, contact me and I'd be happy to help you develop those sorts of things. We have already some posters and things that we can make available, but if there's something you want to develop specific to your workplace, I would be happy to do that. And then finally, we want to encourage employees to seek help without penalty or stigma. Especially don't penalize people for going to a counseling session. Don't penalize people for seeking out help through your EAP or whatever it may be. We really want to be encouraging for them to do that. and not stigmatize it. We want to reduce that gap between the onset of symptoms and seeking help for the symptoms. In March 2020, which is really like right when the COVID lockdown started to happen, when things really started to get serious here in the United States, the National Alliance of Healthcare Purchaser Coalitions surveyed 256 companies, and 53% of them, so a little bit more than half, had begun providing specific emotional and mental health programs for their workforce. And that was like within the previous month. So about half of employers in the United States recognized very early that the pandemic was going to be a major disruptor, and then began providing these programs for their employees to seek out help for emotional and mental health challenges. I would like to see a follow-up to that survey and see how many of them have done it in the year and a half since. So one of the things that you can do as an employer, I was introduced fairly recently as a health benefit, is some employers are purchasing contracts with these app-based mental health supports. So some of them you may have heard of: Headspace, Calm. There's a number of them that are really well respected, evidence-based, and they are a subscription type of service, but employers can purchase bulk subscriptions and make them available to their employees. Just providing access to that, something that they can access on their phone, on their tablet. It's short of counseling. It's really self-help kind of things, mindfulness meditation, guided breathing exercises, things that anybody can do, but within a framework and a context of taking control of your own emotional well-being and your own mental well-being. That's a really interesting avenue to explore if you think your employees would be interested in something like that. I've seen a number of companies now offering that kind of access. Another is offering telehealth sessions. One of the silver linings of the pandemic was that behavioral health providers had to pretty quickly learn how to do counseling through video connection, like we're doing now, except maybe not with 20 people all at once. Although a few places did do group sessions. They did manage to pivot their group, like AA sessions went online. Some of the other group things, group supports like peer supports, were able to use Zoom or other online platforms to really fill in where in-person could not happen. Nobody's saying that telehealth sessions are better than face-to-face sessions. That's not the question. The question is, are telehealth sessions better than no sessions at all? And the answer to that is yes. In most cases, the answer is yes. So the payer sources like Medicaid and managed care companies and private insurance have really, for the most part, made the changes permanent to allow many types of counseling, many types of therapies to occur at a distance over video. Now, the advantage of video sessions for your employees is they can do those sessions sometimes from their workplace. If they have a private place where they can get an internet connection or use a mobile device, they can have their session at your workplace. They don't have to leave work. They don't have to arrange for childcare. They don't have to arrange for transportation. And we know that a lot of people struggle with transportation issues and childcare issues, where a 30-minute counseling session turns into a 3 or 4 hour chunk out of your day because you're just, trying to get to the session and then from the session. If you can do that via telehealth, then it's a 30-minute chunk out of your day and not a 4-hour chunk out of your day. So, if you can, if you have the opportunity, the resources to make that space available for your employees, that's really a benefit you can do at little or no cost. One of the recommendations was stipends for psychological or physical health related services. I think that's really what they're talking about there is incentive packages so that people will be proactive to do preventative kinds of activities. Some of you I know have incentives for walking or other physical activity, for diet and other health related things. Include psychological health in those incentive packages. And then finally, this is one that one of our providers, Vicki Martin, and I think she's on the call today. Yeah, there she is, Vicki M. Vicki Martin is, she's with Recovery and Wellness Centers of Midwest Ohio. She is their crisis services manager, and she also has a private business that she does mental health counseling and consulting to businesses. And we had a little conversation before the session today, and she said one of the things that is most discouraging is that companies who offer EAPs, employee assistance programs, and include mental health services in those employee assistance programs, many times the last time the employee hears about it is after their onboarding session. You go through the interview process, you decide to hire somebody, you do an onboarding, here's our list of benefits. Oh yes, we have an EAP, and then employees never hear about it again. We really want you to encourage the use of your EAP, even if your fee structure is that it's on a pay per session structure. The benefits you will get back in terms of productivity and employee retention are going to far outweigh any costs of that EAP. So we really want to encourage you to offer EAPs and encourage your employees to use those EAPs. Another thing you can do in your workplace is encourage mental health first aiders. Now, I debated about whether to capitalize mental health first aiders because there is a specific curriculum called mental health first aid, and some of you may already be mental health first aiders, and if you are, that's great. I know we've done mental health first aid training in a couple of companies around the Troy area, and we've done it extensively in schools and for other community organizations. Mental health first aid is a curriculum that teaches non-clinical people to identify signs of either a mental health crisis or a developing mental health challenge, and then know how to intervene and then how to refer to resources. So it's a really good program. But I lowercase mental health first aiders because there are other curricula besides mental health first aid that do similar things. There's one called QPR, which is question, persuade, refer. That's specific to suicide prevention. The board has its own training that we've developed here called Mental Health Basics that does much the same thing. But identify people in your organization who can act as first aiders. I'm sure most of you have people in your organizations who are Red Cross trained first aiders, who know CPR, who are trained on the use of your AED, your defibrillator, or who can deal with chemical spills or with things like injuries until professional help arrives, right? That's the definition of first aider. You can do the same thing with mental health. You can get people trained up to a basic level of being able to identify, intervene, and refer without being clinical professionals. And if you identify those people in your organization, then your employees can go to them. They can trust that whatever they say will be held confidential, and that they'll be referred for help that they need. So definitely encourage mental health first aiders in your organization, whether it's actual National Council for Behavioral Health, capital letters, mental health first aiders, or whether it's lowercase, just people in your organization who are trained a little bit in recognizing and intervening. And the second thing you can do is normalize mental health days. Remember when mental health day was a joke, right? I need a mental health day, ha, ha, ha. And what that meant was, I'm going to go fishing, I'm going to go shopping, I'm going to, ride the motorcycle because it's a nice day. I'm taking a mental health day. Well, guess what? Mental health days are a real thing, people. If you don't want people in your workplace because they have the flu and you don't want them to infect everybody else with the flu, then I don't think you want people in your workplace who are having a really bad day and are going to infect everybody else with their really bad mental health outlet. Normalize mental health days. Let people take a day to just, pardon my French, get their shit together. Because sometimes just having that break in routine is all they need. If you're starting to struggle and on Monday you're at 90% productivity, and you come in on Tuesday and you're at 80% productivity, and you come in on Wednesday and you're at 70%, by Friday you're at 50% productivity, and you have lost almost a whole day during the week of productivity from that employer who's just dropping at 10% a day. If they don't deal with that, that's going to persist. If they can take a day, if you come in on Monday and you're not feeling it, and I say, I'm taking a mental health day tomorrow, and you're able to manage that with staffing and with production and, all of the other things that you have to deal with as managers. But if you're able to deal with that and somebody says, I really need a mental health day tomorrow, I'm taking the day off, and you say, that's fine, take your sick leave or whatever works in with your benefits schedule. On Wednesday, they're going to come back refreshed. They're going to be back closer to normal, and you're not going to lose. Yes, you've lost one day of productivity, but you've lost one day of productivity in a positive manner that your employee is going to have a better outlook on you as a manager. They're going to have a better outlook on their job. They're going to have a better outlook on just about everything. So obviously you don't want people taking mental health days every week, but every once in a while we just need one, and that should be okay. Further, what can you do about it? The stressors and the symptoms of the stressors can be clues to how to manage them. So if you identify that dealing with angry customers is the source of stress for your employees, make sure that they get breaks during the day where they are not around those angry customers. They're off the phone, they're out of sight, they don't even hear other people dealing with it. Because even if I'm on my break and I'm listening to other people deal with an angry customer, it affects me. If noise is a stressor, and many of us, are in workplaces where there's a lot of noise going on. If noise is a stressor, be sure you have a break space where they're away from the noise. If you can't get them away from the noise, consider noise canceling headphones. So for 15 minutes a day, they can put that on, listen to some calming music or a guided breathing exercise, and just take a short break from the stressor. A lot of us have employees who sit all day or stand in place all day, maybe working on an assembly line or something like that. That really stresses the big muscles, not having motion, not having movement. So if you can encourage walking, when I was at Edison State Community College, they developed an indoor walking path with little symbols, and people on their breaks would go out and walk a half a mile and just get up off your desk, get up off your butt, Go out, take a little bit of walk, use those big muscles, really alleviates a lot of stress. If you don't have the space for that, maybe a stationary bike or an elliptical where people on their 15-minute break can go in and get 10 minutes on the elliptical. It just uses those big muscles that they're not using the rest of the day, and it's allowing stress to build up. Just some ideas to maybe think a little bit outside the box. One thing you can do is conduct a stress audit of your workplace. Actually go around and determine what is the source of stresses for your employees. Again, is it noise? Is it flashing lights? Is it no access to daylight? It could be any number of things, and determine what in those environmental conditions are contributing to the stress. What can you fix relatively inexpensively? And if you can't fix it, provide respite from it. We want to encourage self-care. Again, the mindfulness meditation is a great one. The breathing exercises is a great one. But we want to encourage people to take care of themselves. They should have hobbies that they find satisfying. Volunteerism is one of the best ways to combat that feeling of helplessness. If you're feeling like you don't have any control over your life, but you can volunteer at the animal shelter one day a month, that gives somebody a sense of purpose, a sense of meaning, and a sense of value. Of course, we always want to encourage exercise, but exercises as simple as balancing and stretching, like yoga or Tai Chi, things that don't require a lot of equipment, doesn't require people breaking into a sweat, just moving your body in a different way than what you're doing your work can help. Obviously, we discourage smoking, but do understand that for people who do use tobacco, nicotine is addicting. It's highly addicting, and withdrawal is hard. Now, I say that because the way nicotine works, if you're an active smoker and you smoke a cigarette, that nicotine rush, if you will last for somewhere around 10 to 20 minutes. After that 10 to 20 minutes, your brain says, I get some more of that. I'd like some more of that. But if their work schedule is such that they, have a cigarette in the morning before they start, and then they don't get one until their break, that's 2.5 hours where their brain is thinking about their next cigarette, and it's not thinking about what they're doing for work. So if you do have people who smoke, understand that they are addicted to the nicotine. That withdrawal is hard, and it's intrusive, and it can sometimes be physically painful. So we would definitely want to look at cessation programs or other incentives to discourage smoking and get people off the nicotine. Understand that people who are suffering emotionally will often use alcohol or other drugs to self-medicate. It's not good. We don't use self-medicate in a positive term. We're using self-medicate as why they do it. You definitely want to watch for signs of addiction. And again, that's, being distracted, the 1,000-yard stare. They're thinking about where's their next drink coming from, or where's their next hit of whatever it is they're addicted to coming from. Definitely want to challenge the sense of hopelessness. Positive actions overcome feelings of fear, and small actions make a big difference. So if your organization has the ability to do so, organize and sponsor volunteer projects as a team. Not only are you building teamwork, but you're contributing to that sense of value, that sense of purpose, that sense of social worth and self-worth. Blood drives, donor challenges, same thing. Or have the employees adopt a charity, and give them input into what charity it is. Don't just tell them, hey, you guys are going to spend one day a year supporting XYZ charity, because now it's just something else that you've given them. But let your team have some input on what charity it is they're going to support and how they're going to do that, and then be supportive of that. Seek professional help when somebody is having trouble functioning at home and at work. If they're experiencing nightmares, if they are generally fearful all the time, even if there's nothing immediately threatening, if they're not able to relax, and especially if they're expressing suicidal thoughts or feelings. If you hear somebody talking about that or somebody confides in you, it's definitely time to seek out professional help. Our website, tcbmds.org/resources, gives you access to a resource guide of all kinds of resources: mental health treatment, substance use treatment, peer supports, just all kinds of stuff. It's like 3.5 pages of listings. You can find that on our website. There's a downloadable version. I have printed versions if you want those. Let Shelby know and I'll get you copies of them, but you can go online and there's an online searchable version of that as well. We encourage people to do self-checks, and we have a free, confidential, quick self-check tool. We call it Checkup from the Neck Up. It goes into it's a third-party assessment, but it's typically like 10 or 12 questions. It takes 2 to 3 minutes to do, and it'll tell you that you're highly likely or somewhat likely or not at all likely to have any particular condition, and then refers to resources. We recommend people do that at least once a year or anytime they're not feeling well. We have our crisis hotline 24/7, 800-351-7347. This should be posted in your workplace, and your managers should have this in their phones. If somebody gets to a crisis point, you want to be able to call that quickly. And again, we have cards that have this number on them. Crisis response team, if you have a crisis, a tragedy in your workplace, and used to be fairly uncommon, but now it's pretty common. Maybe you have an employee who has passed away unexpectedly due to COVID or other circumstances, or you have a workplace accident, or we responded once to a bank robbery. The Tri-County Crisis Response Team comes in with a structured plan to help your employees process through that and identify anybody who may need additional help. That is activated typically by a CEO or a manager by calling the crisis hotline, and then they'll get a hold of us. And Shelby, I'm going to make this copy of the PowerPoint available to you too, in case anybody needs. Okay. Crisis text line. A lot of workplaces are not conducive to people having conversations confidentially, but they can text confidentially. So there's a crisis text line at 741-741. There's a National Suicide Prevention Lifeline at 800-273-TALK. We have specific information for gambling. 800-589-9966 is the Ohio Problem Gambling Hotline. So these are some of the trainings I talked about: QPR training, question, persuade, refer for suicide prevention, mental health basics, vicarious trauma and self-care, de-escalation. If your employees find themselves often in a position of having to deal with angry or aggravating customers, this is training that you might consider. And then we have one that we developed specifically for COVID called Coping During Challenging Times, which helps people understand what the fear response does in themselves and in others, and then things to do to alleviate. A lot of self-care information in that one. All of those you can, if you're interested in more information, you can contact me. My email address is on here, readb@tcbmds.org. You might also talk to Beth Adkins, who's our Director of Clinical Services, or our Executive Director, Terry Becker. Find information on our website, and our phone number is 335-7727. So that brings me to the end of the presentation. Does anybody have